We've talked about the problems with not having comprehensive and reasonable and logical sex ed in schools. And there's now a chlamydia outbreak at a Texas school that is affecting nearly 10% of the students. As it happens, the school has no comprehensive sex ed policy. Now, 20 confirmed cases of chlamydia out of just under 300 students at Crane High School in Texas. This is causing state health officials to meet with teachers and parents to talk about actually implementing some logical sex education. The Crane Independent School District sent out a letter to parents last Friday notifying them that, hey, we've got a chlamydia outbreak, according to the Associated Press. Diana Martinez is a Crane parent with young children in the school district. She said, quote, "This happens in any town, but just for it to hit close to home, I mean, parents need to be aware of the situation and make sure they tell their kids to be safe and practice safe sex. I guess now that it's actually getting big, especially if it's coming out in the news, I mean, that's pretty nasty." So chlamydia is curable. It can cause permanent damage to women's reproductive systems if left untreated. Adolescents aged 15 to 19 have the highest rates of both chlamydia and gonorrhea, which is another common STD, out of any age group in the United States nationally. This is completely unsurprising that Texas, actually, if you look at the 11 states with the highest STD rates, 8 of those 11 are southern states with a sort of so-called moral majority, right-wing, evangelical type perspective on sex education. And this spike in Texas was not isolated to Crane. And in recent years, syphilis cases have happened in Dallas County schools. There have been a number of problems in El Paso. 20 out of 300 students, Lewis. So much for that abstinence-only sex ed.
My question is, if let's just say these students stay in Texas, they live in Texas their whole lives, and ultimately they are parents, teachers, principals, and they are in a position to determine whether or not Texas should, I don't know, change their sex ed policy. Do you think that this would change their minds when they are older?
If it doesn't, then it would be a complete, it would be the epitome of cognitive dissonance, right? If you can't see, oh, let's see, which states are having outbreaks? What's the sex education mentality, the paradigm in those states? And what could we do to maybe change that? If you can't connect the dots here, then you have some serious cognitive issues. Abstinence only, we know, leads to more STDs, and we're seeing that firsthand here in Texas. Abstinence only sex education leads to more pregnancy, and more pregnancy leads to more abortion. So we know exactly what we need to do to stop it. We just can't seem to get people on board, and it seems to be related to these so-called moral hang-ups.
Yeah, religion, these moral hang-ups, but we have the data, and people are ignoring the data. So ultimately, will it make a difference? I doubt it.
I don't know. If you want more info on this, check out the St. Louis study that was done around sex education, contraceptive availability, and the impact on unwanted pregnancy and abortion.